Well, friends, I am Anil Jain. I am Director, Professor and Head of Orthopedics, University College of Medical Sciences, Delhi. Was past President of Indian Orthopedic Association and past editor of Indian Journal of Orthopedics. Well, I shall be talking about bone, joint and spine tuberculosis. Well, if you ask me how old the history of this bone and joint tuberculosis is, it is as old as mankind. It is there on the earth since the human being are there, because the evidence is that it has been observed in fossils 10,000 years ago, and Egyptian mummies were looked into. Those mummies who were dated 3,100 to 4,005 years old, they also had evidence of spinal and bone tuberculosis. Well, it is a dangerous disease. Why? Because the evidence is that if you look at the deaths that have occurred in Second World War in 56 months, they were 6,802, while in that duration 7,997 people were killed by tuberculosis. So, it is as deadly as the World War. Now, if you look at the current scenario, it is among the top 10 reasons for death in the world. It is 9th in the ladder as per this 2015 census, and it is affected, the 10.4 million were recorded affected by the disease, although I believe that not all patients in the world have been recorded. So, I consider that there would be almost double amount of number of patients of tuberculosis in the world, and almost 1.7 million deaths have been recorded in the year. However, I still consider that in lots of countries where the data is not recorded, the death rate is more than actual recorded. Now, 64% cases of tuberculosis occur in 7 countries, and India has the unique distinction of leading the tally with almost 25% cases, while Indonesia, China, Philippines, Pakistan, Nigeria are the other South African countries. Now, the question comes, what causes tuberculosis? Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. It affects first the lung. So, and this produces a pulmonary tuberculosis, a lung tuberculosis. Now, this pulmonary tuberculosis in a very younger child comes as a primary complex, and that is either being resolved by immunity or by treatment. Then these organisms are lying dormant in different part of the body, and as a secondary, any part of the organ can be affected by the tuberculosis, and all organ in the body, from skin to any other other organs, they can have tuberculosis. Even such as small middle ear, tonsils, backbones, intestine, reproductory organs, kidney and bladder, bones and joints, all can have tuberculosis. So, what is so different of bone and joint TB as far as the pulmonary TB is concerned, or all other TBs? Because it destroys bones, and once it destroys bones, so it damages the extremity, and you could see here the hand is damaged, and this joint is affected. So, it deforms the joints. Now, if it occurs the back, the spine is affected, the back is affected, then it can cause paralysis even. So, you could see here, if the spine is affected, then it leads to the deformity of the spine, and it can even lead to paralysis. So, these are the severe damages produced by bone and joint TB. Now, which bones are affected? Out of the human body has 205 or 206 bones. So, which bones are affected most? It is the backbone, that 50% of the cases are affected by the backbone is affected, and backbone is damaged. After that, the other joints comes in the picture, and hip joint is the second most common, and the knee, ankle, shoulder and elbow in that order. So, that is how these bones are being affected. Now, which age and which sex it affects more? I think all ages. It has been recorded even in the child as young as 6 months to as old as any age. It affects any both the sexes. So, it is any sex can be is affected. So, it does not, this disease does not leave anyone. Now, what are the early symptoms? When the patient comes with a pulmonary, then these or lung tuberculosis, then they have a chronic cough, night sweats, fatigue, weight loss, chest pain, fever, anorexia and hemoptysis. However, when it comes to the bone, then a pain in the one localized part of the body with a persistent pain. Say if a spine is affected, back is affected, then a localized pain which is persistent for 6 weeks or more with feeling of being unwell, or there is a feeling of that person feels that he does not have good appetite, or he may have some weight loss as well. And in due course of time, if it's not being diagnosed at this point of time, then they come back with the deformity as been seen here of the back. So, this back has become a crooked or a deformed back. Now, what should a patient do if patient has a symptoms like this, that a patient has a persistent back pain or persistent limb pain for 6 weeks or more, which is localized with the constitutional symptom? What the patient should do? He should report to any orthopedic surgeon immediately, because this percent localized pain for 6 weeks or more in the back or in the joint, or feeling of not being well, is the initial symptoms before for the suspicion. However, if the person does not report at this point of time, then what is going to happen? Disease is going to advance and is going to have a severe joint destruction, and you could see here severe joint destruction of the hand, severe joint destruction of the finger, of the joint. So, these joints can be severely destroyed, and even if it is back, then a severe spine involvement or backbone destruction to produce a deformed back. So, let us take, because spine is the most common 50%. So, let us take how does the spine presents. These patients present with the insidious, slow growing, persistent pain with constitutional symptom, some stiffness or with every movement of the spine, or some pain with the every movement of the spine. And if neglected at this stage, patient does not take care of at this stage, then they may develop swelling, and if further advances, then a deformity like this, or if further progresses, then a deformity, back deformity like this, and even paralysis. So, that is how the spine TB starts and ends if it is not being treated. And the most common cause of spinal deformity is tuberculosis, and tuberculosis causes most common deformity because it causes destruction of bone, and as these vertebral bodies bones are destroyed, the spine buckles over it, and that is how it bends over it, and the back develop a clinically or visible deformity of the back. Now, in children, this deformity progresses very rapidly, and hence we have, because these children bones are very soft, they melts with the disease process, and these children have to be taken care of, should be diagnosed or should be taken to the doctor very early. Otherwise, they are going to develop a very advanced deformity, and you could see here such a back in 3 months time developed such a severe deformity. So, in children you have to be little more careful in finding the cause of the illness of the child. Now, spine, if when it is affected, it can even give rise to paralysis. Why it gives a paralysis? I think if you have to understand, this vertebral column has bone in front and bone behind, and in between two there is a spinal cord running from head to the tail of the body. So, which gives the nerves, which carries the nerves to the different part of the body. Now, if this bone is destroyed, then this disease tissue enters all around the spinal cord and give rise to pressure onto the spinal cord and give rise to paralysis. So, you have to understand that how dangerous this disease is. And you could see this diagram, that these are the body and these are the posterior back part of the spine, and this is the spinal cord. So, if there is a disease here, and this disease tissue, when it buckles over, it presses onto the spinal cord to give rise to paralysis. Now, how the diagnosis can be done for spinal TB? So, for diagnosis of backbone TB, the doctors, they first take an X-ray, and sometime in the disease on the X-ray is visible here, and one is able to diagnose even on the X-ray. So, here one is able to diagnose it. However, sometime the help of MRI is required, and MRI is able to help us in making a diagnosis of tuberculosis. Now, even the blood tests are always helpful to make the diagnosis of tuberculosis, and some blood tests like ESR and complete blood picture and the Montoux test, some tests are done. Now, biopsy where the tissue is taken from the diseased area and that is visualized under a microscope gives us a definitive diagnosis for tuberculosis or by culture of the from the biopsy specimen. Now, when TB of the backbone are diagnosed, what one should do? One should follow religiously the advice of doctor, use spine braces on the advice of doctor, and it is important because this bone is weak. This bone is weak by disease, and if you do not give a spine brace, then this bone can break and can put pressure onto the spinal cord and can give rise to paralysis. So, that is why it is important that these braces are used on the advice of doctor. It is not very uncommon for patients coming to outpatient, do you have brace? They say yes, they have brace, but when we ask where is the brace? Sir, it is lying at home. See, person has taken the trouble of coming from home to the hospital by traveling in a car or scooter or three-wheeler or rickshaw, and he is not using the brace. So, he should be using the brace as been advised by the doctor. And these are different kind of braces which are being advised depending on to the different part of the body being affected. Now, anti-tubercular drugs is the treatment, and that has to be given on a daily basis as per the advice of the doctor. There are 4 drugs to be given. One of the drug is rifampicin, is a capsule which is given empty stomach, and one patient has to look at the orange color of urine turning orange, and if the urine is not turning orange, then it means the drug is spurious. So, one has to be watchful that he is using taking rifampicin empty stomach and urine is turning orange in subsequent part of the day. There are 3 more drugs. The total duration of ATT is somewhere between 12 months to 18 months, and patient have to be government is providing through the DOT centers these medicines free of cost. Now, in children, child should be under observation till 18 years. As we know that this deformity progresses with growth. Deformity increases as the child grow, as the child attain the maturity, and hence these children have to be kept under observation. So, if the spine TB is diagnosed, anti-tubercular chemotherapy drugs are the key to treat it. So, what are the pillars of the treatment? Medicine, rest, active or assisted exercise, and if needed, operations are required in a spine or a bone and joint TB. Our plan, our objective of treatment is eradication of infection, pain relief, and we want to preserve and restore the function of the person, and we want to preserve neurological status or restore it. That means that while treating a TB tuberculosis spine, we ensure that patient does not develop paralysis, or if paralysis has developed, then how to get the recovery of paralysis. So, these are the aim of the treatment. Now, when persons come, spinal back pain tuberculosis comes with paralysis, then again bed rest, ATT chemotherapy drugs with or without operation is the treatment, and if treated well, there may be some patients may require operation, they may and some patient may not require operation, but if treated well, there are good chances of recovery of paralysis. So, that is why you don't have to feel that if the paralysis has occurred, then nothing can happen. There are very good chances of recovery from paralysis in the present line of treatment. Now, if patient has already developed such a severe deformity, I think these require a complex operation. These deformity correction, these are big surgery, complex surgeries done at the specified center by the experts in this field. Now, when other joints are affected, like any other joint, hip, knee, ankle, or any other bone are affected, then even if the disease is treated well, this deformity persists, and for these deformity, some reconstructive operations are required. Say for example, if hip is destroyed completely, then even total hip replacement is required. So, for all, depending on a different bones which are being affected, complex reconstruction surgery are required. Now, you will ask me one question: is it infectious to others? Does it some person is having this tuberculosis, does it infect others? No, these are extrapulmonary tuberculosis. Bone and joint TB and spine TB is not infectious unless there is a pus discharge. So, most of the time it is very safe, it is not infective to other. However, if they have an associated lung disease, that is why doctors always investigate for associated lung disease, then they may be infectious. Now, how can I prevent bone and joint TB, occurrence of bone and joint TB? I think the best way is to have a good nutritious diet, so that your body resistance remain very good, and because whenever there is a low body resistance, the sleeping dormant bacteria, mycobacterium in the body, they starts growing, they starts multiplying, and a disease occurs. So, it is important that we get a good nutritious balanced diet to maintain immunity, take good vitamins and take good exercises, and once early symptoms occur, then report to the doctor, so that if diagnosed, a complete treatment can be given. How much I can improve? I think with early diagnosis, if you have reported to a doctor with an early symptoms, what I said is persistent pain for 6 weeks or more for investigation, then, and if you have been diagnosed at this stage, then with effective treatment, tuberculosis of bone and joint can be treated with near normal bones, near normal joints and spine. Well, I think your involvement, your participation in diagnosis and treatment and eliminating TB is more than the doctor. So, let us all contribute to eliminating tuberculosis from India and globe. And friends, and this is the book of tuberculosis, bone, joint and spine for experts, written by me. Thank you very much indeed.